Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. The feature presentation is on potassium, a vital mineral for human survival. Yes, indeed. Potassium, if you look at the periodic table, you see potassium is a metal, it's an element, and it is readily available in the nature in the form of these blocks. Potassium plays a very vital role in the function of various organs, especially the heart. And we need to learn everything about potassium, especially if someone is taking potassium supplements, or if someone is on water pills, or someone has history of heart disease, because potassium can play a significant role in maintaining normal health, especially in patients with kidney failure, where potassium levels can go extremely high or extremely low. And how do we deal with those? How do we diagnose? That's the main feature of this presentation. So we are going to look at what is the role of potassium in the human body. What is the normal potassium level? What are the signs and symptoms of low potassium level? What are the symptoms of high potassium level? High potassium level, like here, like a peak. Then what are the means by which we can supplement potassium through prescription medications and supplements and natural food products? So let us continue with the feature presentation. Potassium, as I told you, is a very important element in the action of the both heart muscles and the skeletal muscles. When potassium moves inside the cell, it relaxes the heart muscle. It relaxes the skeletal muscle. Whenever there is changes in the potassium level, it affects the muscle function. So potassium is essential for contraction of the muscle, both in the heart and also in our skeletal muscles. It also helps in the transmission of nerve signals. As you know, the brain has brain cells. From the brain cells, we get these little nerve connections that go to the secondary nerve cells. And from there, they are relayed to the terminal organs, like the skin or the blood vessels or gut, like that. It also helps to regulate water balance. And potassium is essential for maintaining cell function. Most of the cell functions require potassium as an element in their chemical processing. And the role of potassium in kidney is exceedingly important, especially those patients who have kidney disease. They need to understand very clearly what is potassium, what their potassium level should be, and how to look for signs of high or low potassium levels. Potassium helps to support blood pressure. Potassium also helps to maintain fluid balance inside the cells. The cell function is sort of performed to a large extent by the presence of potassium both inside the cell and outside the cell in the interstitial space. The normal potassium levels should be from 3.5 milliequivalents to 5.1 milliequivalents. Just remember 3.5 to 5.1. Now, what happens when the body is running low on potassium? Sometimes we see patients who come to the hospital with a potassium level of 2.0. The minimum is 3.5 when there is extreme depletion of potassium in the body. What are the serious symptoms of low potassium level? There can be muscle cramps, muscle weakness, fatigue because you don't have enough strength in your muscles. It can even cause paralysis if the potassium level is extremely low. It can also cause constipation. It causes respiratory failure. And the most important of which is low potassium can cause extra heartbeats, which can lead to serious heart arrhythmias. So it is exceedingly important for us to pay attention to the potassium levels, especially if you have heart condition, kidney problem, or if you're on medications. What are the causes of low potassium to begin with? In most cases, Low potassium is due to dietary inadequate intake of potassium. The second most common cause is the drugs. Because as a cardiologist, we deal with patients with heart failure. We give them diuretics or the water pills. When we give them water pills, it depletes the body's potassium. When it pushes the potassium from the body into the urine, their potassium levels go down. And when their potassium levels go down, they develop these symptoms of low potassium, which I just showed you in the previous slide. Drugs are the number one cause of changes in the potassium levels, namely the hypokalemia. Or there are some conditions where inadequate input, that is, people who are malnourished, people in nursing home who are not properly getting proper food, or people who are debilitated, who can't eat or drink, they can run into low potassium levels. People with colon problems who have frequent diarrhea, they can lose a lot of potassium in their stools and thus lose the potassium levels. Some endocrine problems like Cushing's syndrome can cause excess elimination of potassium, leading to low potassium level. And people who are in the hospital where they have a tube in their stomach to drain the stomach, that tube not only drains the fluid, the acid, it also drains all the potassium in the stomach, and that can drop the potassium level. So what are the signs? Patients could be lethargic, they can have cardiac arrhythmias, as I showed you in the previous slide, and they can have muscle cramps, weakness, fatigue, and low blood pressure if the potassium is exceedingly low. Now let's look at the other side of the potassium problem. What if somebody has very high potassium levels? Who can get high potassium levels, and what are the symptoms and signs of high potassium level? The best example is patients with kidney failure. They have problem getting rid of salt, sodium, and potassium. As a result, when patients with kidney failure, especially those on dialysis, if they don't go for a dialysis on a regular basis, their potassium levels can build up like a tall peak stones, and they can cause serious cardiac arrhythmias. It can slow the heart rate, and it can also diminish the heart function altogether. So high potassium levels and low potassium levels both are exceedingly dangerous unless you are under a medical supervision. So high potassium level can cause heart palpitations. I told you they can cause extra beats, it can slow down the heart rate, and it can cause significant changes in the electrocardiograms, which are really characteristic of high potassium level. Whenever you see a patient with a kidney failure who has missed a dialysis, come to the emergency room and you see these EKG changes, the first thing we think about is high potassium level. I'm going to show you an example of that EKG in a minute. Again, people with high potassium can also have muscle weakness. They have nausea, vomiting, they can have diarrhea, and they can have abdominal cramps. So these are some of the things we need to look for. The most important thing is muscle weakness, irregular heart rhythms, and electrocardiographic changes. Of course, you can get this blood test done in 20 minutes and you know exactly what the level is, and then see how it has to be treated. Very high potassium levels need to be treated in a hospital, preferably in an intensive care unit with very aggressive intensive care management. That's a different story altogether. So, all right, the other causes of high potassium levels are patients with diabetes. They have a tendency to have high potassium levels. Medications. A classic example is, as a cardiologist, we prescribe certain medications which helps the body to retain the potassium. However, if you give the same medication in a patient with heart failure and kidney failure, they may retain too much potassium, causing hyperkalemia or very high potassium levels. Similarly, heart failure patients, because they can't get rid of the fluid, the salt, the potassium also stays in the body, plus they are taking potassium supplements. Combine that together, they can develop high potassium levels. And kidney failure is the best example of seeing both low and high potassium levels. Here's an electrocardiogram where we see classic changes of low and high potassium levels. When we look at the electrocardiogram, if I'm just reading an electrocardiogram like this, I would say, okay, suspect low potassium level. When we see an ST depression and a flat biphasic T wave, that's a sign of a low potassium, and also they have slow heart rate to begin with. This is a normal electrocardiogram, and in patients with increasing levels of potassium level in the blood, the T waves become peaked like a tombstones, and this hyperacute T waves, as we call it, is very, very significantly pointing towards hyperkalemia, especially in the context of patients with heart failure who are on potassium supplements, or patients with renal failure who are on dialysis or who are on other medications. So keep that in mind, and when the levels get exceedingly high, the EKG becomes like a sine wave, and that's like a dangerous level of potassium that causes that. Let's say someone has a low potassium level. What do? I would say you consult with your physician. Uh, Potassium is not something you can treat by yourself. It is a very serious situation, because low potassium is as bad as high potassium, and you don't know how much potassium to take and how to monitor your potassium and how to regulate your dosages. The best thing is leave it in the hands of your primary care physician or a specialist like a cardiologist or a nephrologist who know how to balance these potassium levels, knowing what the heart condition is, knowing what the kidney function is, and how much potassium you need to delicately balance the potassium level, because you want to keep that within that range 3.5 to 5.1. So potassium can be available as prescription medicines like potassium chloride, potassium gluconate. They come in the form of 20 milliequivalents, generally given once or twice a day, and that's the best route to go. If you go through the drugstore, you see a multitude of potassium supplements, but they don't measure potassium supplements like we do in the medical profession, where we call it as milliequivalents. 20 milliequivalents is equal to 750 milligrams of potassium, but here they mention in terms of milligrams. So you don't know exactly how much potassium you need. Plus, you don't know how pure this potassium is and how well your body is going to absorb these potassium levels, because there are no studies to suggest how good they are. Plus, some of these combine other minerals which can cause more problems than you started with. The natural ways to get your potassium levels are here, and let's go into some of the details into these medications. For example, you can see all these potassium levels, 99 milligrams, then 500 milligrams. They are all over the scale. So actually, you think you may be getting adequate potassium level. In fact, you are not. Plus, sometimes you could be overdosing on potassium levels if you're taking like 500 milligrams like 4 times a day or 6 times a day without knowing what is the right dosage. So the best thing is to consult with your physician who can get you right prescription medications that are well tolerated and have predicted effects on the potassium levels. As far as the natural foods that are rich in potassium or something that it's worth looking into, because if you are just running a real low potassium level and your heart and kidney functions are normal, like bananas are supposed to be very well known for having high potassium levels. Similarly, orange juice and cantaloupe, mango. So these are some of them. Then the vegetables, avocado is another one, broccoli, and some of these milk products, they have an adequate level of potassium level. In other words, your diet should contain a balanced supply of fruits, vegetables, and other products, meat, that contain potassium level to adequately replenish the potassium that you lose daily in your stools and in your urine. So ladies and gentlemen, here are the prescription type of medications. They are available in like tablets. They are pretty big, like a football. and this generally it comes in 10 or 20 milli equivalents. That's the medical term. Don't worry about it. Your doctor will decide how much you need. And I would say, stick with your physician when it comes to taking potassium supplements, because as I said, they need to be closely monitored with blood tests in conjunction with the knowledge of having heart disease or kidney disease or diabetes. So, ladies and gentlemen, you have been listening to a presentation on potassium, a vital mineral for human survival. Now you know what the normal potassium level should be, what are the causes of low potassium level, what are the causes of high potassium level, and what are the signs and symptoms of these, and how it is managed if you are having low or high potassium level. Thank you so much for watching this presentation, and please do subscribe to our YouTube channel. I just made a video the other day on the role of magnesium, which is similar to potassium, an element that also plays a significant role similar to that of potassium. So I would suggest you watch that video, and we have more than 300 videos educating public on heart and heart disease. Thank you so much for watching, and I will see you in the next presentation.